Welcome to Get Broadcasted, a new session with our famous, world-renowned Dr. David Shiller.
Dr. David
He
Shiller.
doesn't like that. He's a very humble and talented person at the same time, but we love him, so we had to introduce him that way. Anyway, I don't know if you've seen the first session together with Dr. Shiller on Get Broadcasted, but it was all about utilizing various integrative, how do you say it? Integrative methods, using medicine, mind, body, therapy and diet and exercise. He'll explain all this, but it's a great integrative system that takes into consideration many other formats of helping improve the quality of our lives. And if you go look at that, you get a great summary about who he is and how that the basics of that integrative system. But today we're going to go into more about how to deal with anxiety, stress, normal stressful experiences of life that happen all of the time, most especially now during the Corona season. So take it away, Dr. Shiller.
Great. Okay. Thanks so much. So the idea is, my printer just turned on and it's going to print something. So,
all right, that's normal. That's all right.
Are you feeling stressed right now? Because
not so much.
Hey, do you always print stuff during an interview?
No, but I meant to print this out. It's my notes.
Okay.
And I realized it's on the screen, and we're gonna screen share. So
can't wait.
Okay, it's done. All right. Thanks, Melek, for that introduction.
Okay. Yeah.
Thanks a lot for that introduction, Melek. So, you know, I think the idea is how to talk about the whole world of a more holistic perspective to understanding health and well-being and illness, and that incorporates really what I would describe as the modern science of integrative medicine. And there's a lot of science that's teaching us about the effect of mind and body on each other, how it's an integrated system. And that's more and more showing up in mainstream medicine, depending on, you know, what doctors you talk to. But there is a substantial amount of science behind it and a substantial amount of clinical experience and clinical research. And so, you know, I think a good place to start, especially given the context, is just sharing a case. You know, somebody who came to me just a couple of weeks ago who basically he expressed to me was that he was having on and off pains in his chest, sometimes difficulty breathing. He wasn't sleeping very well. His doctor had put him on some sedative medication called Klonopin or Clonex, which is a sedative medication like Valium. And he was having a lot of trouble showing up in his job and for his family. And just to put it in context, this was a very high performing person. This is a guy in his 30s who had no previous illness or anxiety, who had navigated a lot of very difficult personal changes, got an advanced degree, had a couple of kids, had gone through various, and really rose to the creme of everything he had done in his life. Super talented, smart, likable, humble guy. And what happened was, it was a COVID thing. And just before, about 2 months ago, towards the beginning of this pandemic situation, he got what sounds like the virus. He didn't get diagnosed specifically with a test, but he developed coughing and fever, sore throat, the classic signs. And he had a couple of really intense nights where breathing was more difficult. And he was in his apartment, lying on the couch, up all night one night, thinking he was going to die. He called the ambulance, the EMTs, and they came and they checked them out. And they said, yeah, you probably have the virus, but you know what? We're not taking the people to the hospital unless you're really sick. So he stayed at home and just rode out a really hard night. And then he had the experience of one of his close friends' father actually died from the virus.
Oh,
and this
just
is
to add
also
to
a
it.
guy. Yeah, exactly. And so he also has parents who are older, and thank God they're healthy, but they're older and considered to be vulnerable. And so it really kind of turned his world upside down. And he got better from that viral illness, but had these persistent symptoms of anxiety and difficulty sleeping and just not having the head to be himself. And so that's sort of I guess, just a starting point. Because again, this is not about someone who's mentally ill. This is about someone who's actually quite competent and well adapted and successful in life, who's in a not normal situation that did something to his physiology and created a situation of persistent anxiety, lots of difficult thoughts, inability to focus on work and family responsibilities, inability to sleep well without medications, and persistent like chest pain type symptoms. So let's just talk about like, how does it happen? Like, what is that? And what's the stress system and what it's about? And because we have in your brain, you've got an inner brain, you've got what we call the autonomic nervous system. And that's got a stress response and a relaxation response. And we'll talk in more detail about this. But the whole idea is that your stress response is get up and go. It is fight, flight, freeze. And your relaxation response is more like rest and digest. And they're meant to be in balance with each other. So I prepared some pictures just to sort of talk this through that might make this sort of seem a bit more interesting and give it a little bit more light. So let's just look at that together.
Please.
I have one question as you prepare to share the screen.
Yeah.
When this, in the example of this particular person, or for that matter, anyone else, when they're in this state of feeling what you've described, or reacting to to the rest of their life with a new perception, so to speak, are there any medical ramifications that a person switches like and can't get out of? I don't know what the right word, like, I mean, is it just like you thought you were going to, die, and I'm just going to teach you to breathe deeply and soon that's going to go away? Or is it like now the brain there's some juices or something going on in the person's body, right, that they're just, they need real help, or they're just stuck in that thing?
You're asking if that can turn into something physical, like that actually makes him die?
Oh, okay. Well, I didn't go that. I didn't mean to die. I just meant like, well, is it a physical change in the body, or is it just like, it tricks the brain into thinking something's going to happen, and he's just going to feel stressed out because he's just perceiving something incorrectly. And when you teach him to think differently, he'll go back to himself. Or is it like, if you stay like that too long, there's something physically happen, your body now readjusts, and I don't know, like. I say that because sometimes I've seen family members, friends really stay for a long time like that. And it's like they've gone for help and people speak to them and they just can't talk them out of it easily. Sure. And it's just like, well, if it was just a brain thing, it's like, you thought this was red, but it's blue. And I convinced you it's blue, and now you're not nervous anymore. Right? Red scares me. It's not red. It's really blue. You know what I'm saying?
It's a great question. It's a great question, because I think the root of your question is this something that's in the person's mind, or is it actually in their biology and their physiology?
Perfect.
Right? And
didn't know how to say that.
and yeah, most people don't. So like the answer is that it's in both, and the extent to which it's more of a mind phenomenon versus a body phenomenon is dependent on a lot of different factors that are genetic and lifestyle and the person's history and what exactly happened to them, and whether they have other illnesses. And I'll talk a bit more about that as I kind of go through the discussion. But it's a great question. And, I think my sense is that by and large, we live in a world where people tend to think about, well, it's either my mind or my body. And my sense as a doctor who studied the science of this and worked with tons of people over the course of more than 20 years is that whole premise is false, right? That the body and mind are not separate entities, that the processes that we think of mental, like thinking and feeling and deciding and these various things, have physical implications because they're associated with biochemical and electrochemical changes in our brain and our body. and vice versa. If I have an experience that's painful, or I have an inflammatory illness or some sort of physical, quote unquote, physical problem, it impacts all of my mental and emotional processing. And they're not separate compartments. The idea that they're separate compartments is just an artifact. It's like an accident that crept into science years and years ago, and it's falling out of favor. We're starting to see, you know what? It's an integrated picture.
Wow.
Yeah,
Amazing.
there's a lot to say about that. There's a lot of science about it. And I think there's also, you know, what the spiritual and religious traditions of the world teach us. And so in the Torah tradition, for instance, we don't have an idea that there's a mind and a body. You know, the Torah talks about a nefesh. And then later sources talk about there's guf and nefesh and ruach and neshama, and these different levels of a person's, so to speak, mind and spirit, but they're understood to be entirely interpenetrating with one another. And they have different qualities and aspects, but they represent one indivisible self.
Awesome.
All right, so let's share. We'll talk more about this. You know, so chronic stress. Chronic stress is a state of physiology, and it's a set of patterned thoughts, and it's a behavioral state. And these are some of the changes that have been measured that we know are part of it. That chronic stress and the activation of that stress response is part of what contributes to anxiety and depression. We know that chronic stress contributes to worse pain and things like headaches. We know that people who have chronic stress can have worse job performance and relationships. We know that your immune system is so intimately connected with the stress and relaxation response that stress shifts the functioning of the immune system. When someone has an acute stress, like a sudden dangerous thing, or running to play sports, or something that's temporary, it actually amplifies and intensifies the function of the immune system. But when stress becomes chronic, it impairs and reduces and suppresses the immune system. And we know that there are a number of different chronic illnesses that can either be triggered by or worsened by stress. For sure, that's well known among all of the inflammatory illnesses and autoimmune diseases, stuff like rheumatoid arthritis and multiple sclerosis and inflammatory bowel disease and all of the other diseases where the immune system has gone awry and is starting to attack the body. We know those can be triggered or worsened by different mind insults to a person's sort of stress response. So what is stress? Let's just start talking about that, like definitions of stress. And this is an important sort of bifurcation. There's two possibilities here. Is stress the external thing? It's the stimulus or event that creates the stress response? In other words, or is stress the actual response itself? So for instance, I'm sitting in my office, and if suddenly I hear a big boom and I smell smoke and I think there's been a fire or a bomb went off, that's going to create a stress response. Well, it comes to the question, what's the stress? Is it the stimulus or my body's response to the stimulus? And our culture blurs the distinction, because people might say, wow, that was stressful, and they're talking about the experience. But then another person might say, I feel so stressed and anxious, and they're talking about their physiology and their subjective bodily sense of things. Okay, so is stress the stimulus? Is stress the response to the stimulus? And the answer is both, right? Okay, so what determines if an event is stressful or not? And again, this is research-based stuff, lots of science in the past 40 years, looking at the physiology of stress, which I'll talk about in a minute. But here are some of the things that determines it. It's very much about perception. So somebody who's accustomed to interpersonal conflict and argument, that's what they do for a job. Maybe they're a lawyer, maybe they're a policeman, and someone comes to them and starts like saying something sharp to them. That might not bother them that much. But somebody who's a bit more refined and delicate, who's used to being in a more sort of delicate atmosphere, that might be very stressful and upsetting. What does a person believe about stress? You know, And I would say like most of the late 20th century and early 21st century, we developed all this science about stress. And the science about stress told everybody stress is bad, right? And that's the impression. And that's the slide I showed you with all these things that are caused by chronic stress. There's a more nuanced view that's been developed in the past probably 10 or 15 years that's looking at the way a person perceives the meaning of stress. Like, do I perceive that stress is something that enhances or something that's detrimental to me? And clearly this is really complex. It depends how much stress, depends how intense. But for instance, someone who is, for example, an academically oriented person who sort of loves to study and learn and is used to taking tests and writing papers and being critiqued, often experiences the stress of that as a positive thing. I'm on my game, I'm doing my thing, I'm doing what I have to do. Somebody who's got to get up and perform in front of people, they're familiar with the feeling of stress. And when they feel it, they learn to feel it as I'm pumped, I'm doing it, and it enhances my function. And that's very different than someone for whom, oh my gosh, the stress is overwhelming to me. And there's actually been studies looking at, can you change that perception of, is stress helpful to me or dangerous to me? And it has an influence on the actual physiology of what happens in the body. Wow. So it's pretty amazing.
So if somebody, let's say we're about to walk into a meeting in front of the executive board of a company and they felt really invigorated and ready to go, but then they just froze from, I guess you want to call it stress or just fear of rejection. So what would you call that? Would you call him, he just didn't take advantage of that stressful moment in the correct way?
Well, you know, it's a pretty complex picture. And like, as just common sense tells us, so the research tells us in this case, where everyone's got a threshold of what's the amount of stress that makes me feel alive and charged and good, and what's the amount of stress that is overwhelming for me. And so in the example you're giving, suppose this guy, he's used to giving presentations and he knows that feeling when he gets some butterflies in his stomach, but he's used to it. He's like, okay, that's my pregame feeling, you know, and he gets up for it. But then he goes in there and the CEO just like shuts him down after the first question and says something insulting to him. And he's like, and he just freaks out because like he's not used to that. So I think it's very variable. And it sounds like that guy, he went above threshold. And so he got into a more difficult place. What I want to share just about this case that I brought about this young man who came to my office with all of these symptoms, part of what we talked about was his surprise, because he had expressed that, hey, look, I've been through a lot of stressful experiences in my life. And I've always done okay. You know, I did really well in my early school, in my religious training in yeshiva. I worked hard. I did a lot of exams, and then I went to graduate school, and I, you know, and I did well with it. It was okay, and none of it bothered me. Now, why does this bother me so much? And we reflected on it together, and what came out was that he'd had a lot of stressors that he dealt with, which were interpersonal stress and exam stress and performance stress, and he did fine with that. But this was mortality stress. This was, he felt like he was going to die, and he felt like he was part of this cataclysm where the world was coming to an end. His parents might get sick, his friends fought, you know, it was a whole different kind of stressor. Okay, so let's move on. We were talking about what determines if an event is stressful or not. And then the next one that comes up, how intense is the biological response to a stress? Or you could also say how intense is a person's perception about how difficult and overwhelming that is. And, you know, these things are obviously very individual. And there are genetic aspects, there are conditioning aspects, the way a person is sort of trained to be in the world. There are things we learn, there's things we, there's a lot of different factors that are very individualized. And the last thing is, does the stress response shut off or persist? And so as you can imagine, like if somebody has a mild stressor, the stress comes and then they come back to normal because we've got this balance in our system. Our human form, our mind-body system is self-correcting, right? If you run up the stairs, your blood pressure and your heart rate and your respirations will go up. And then when you sit down, they'll come back down towards normal. We have these normal fluctuations. If somebody has a really huge stressor, or a stressor after a stressor after a stressor, or the stress is just constant and they don't get any opportunity to come back to baseline and relax, that's when stress can start to build up. That kind of makes sense?
Makes 100% sense. It's
All right.
very interesting, a lot of what you're saying, because I always translated the word stress as an event that only happens in a bad circumstance.
Right, right.
I did not know that the word stress, I'm just listening, hold on, I don't want to keep speaking, but I'm amazed, because I'm thinking, I had no clue. I just thought, like, for example, when you were giving examples, you're ready to get up and speak, or, Cutler, you were giving the example, you're getting ready for your boardroom meeting, and I just called that like, I didn't call that stress. I called that like butterflies, like tense, like hype yourself up, get ready, because there's a feeling of nervousness. But I didn't know that nervousness was called stress.
Right.
I'm just repeating myself. I thought stress was when things are going wrong,
right,
and
right.
you just can't deal with them. You are now under stress.
Right, right. And that's a great observation, and because and I think that's what sort of generated this whole line of research that's looking at how a person perceives stress, right? Stress is the underlying physiology of get up and go. And the question is, when I experience that, do I experience it as threat? Like, oh no, this is bad? Or do I experience it as, oh yeah, no, this is me just getting up to do something I care about? Playing football is stress. Dancing at a wedding is stress.
When you say that word, I get nervous because it's negative to me.
Right, right. And
I hear what you're saying. Wow, I got to readjust that. That's like major to me.
Well, we'll talk about it later probably, but that's one of the powerful tools that people use when their stress response has gotten out of control and it's giving them bad effects. And one aspect of that is reframing. So in other words, when a person who has stress associated with physical symptoms, like a lot of people with anxiety, they get panic disorder and they can't breathe. They have a panic attack. They can feel like they're dying, like there's pressure in their chest. They can't breathe. Their heart's racing and they lose it. They can't think straight. And so there's various techniques depending on how intense it is. But one of the techniques that people use to learn how to deal with stressful circumstances is reframing the physiologic symptoms. Like, oh, I'm feeling that tightness in my neck or that butterflies in my stomach, like you said. And realizing, you know what, this is just me getting ready to do something important.
Wow. I would gather from what you're saying when I look at my life that I'm doing quick calculation in my head that some of those things I can reframe, but some things that we're now using the word stress way more broadly than I have, so I've got to adjust myself to that. The problem is you can't fix the situation, or you can't figure out a way to turn it positive. So you're under stress. So a stress like Cutler was giving, or we're discussing a boardroom, or getting up and speaking in front of people, I can see reframing that to be like, this is a great opportunity of great opportunity of a lifetime. Well, you can readjust that to, like I reframed it, and I didn't know I reframed it. I just didn't call it stress. I said those butterflies in the stomach. That meant like the opportunity, like it's going to bring out the best in me. It's the opportunity to make a great presentation, right? But if something is constantly negative, God forbid, there's a sick person in the family, you just don't want them to be sick or dying. You want them around. Or your person is, I don't know, just can't pay their bills, and it's like that for years and years and years, or and it's they just don't know what to do to fix it, and they keep feeling that feeling, and they keep reframing like, well, this is just great because I have more time with my family now. Like whatever, but it's like it feels like it's going to become fake, and you can't get out of it.
Yeah, I hear it. My sense of it from kind of a clinical point of view, and from what I know of the research, is that there's a lot of different levels to the adjustment and coping strategies and retraining strategies, right? You mentioned reframing. Reframing is kind of retraining thought process about how to relate to it. There's also retraining processes, which is about shifting the actual physiology of, and there are techniques and tools that you might call mind-body training or mind-body tools that are really about shifting stress physiology. And it's no joke, you know, like the initial experiments that were done with this, you know, I think the 1980s or 90s, Harvard Medical School, Dr. Benson and all of that, looking at the actual physiologic responses of a heart rate and blood pressure that people had to a kind of experimental stressor. And you know, a person, they do these things in a laboratory. I can show you pictures of the research if you want, but it's like a person has a certain increase in their heart rate and blood pressure based on their lab stressor. And then they do like 3 or 4 weeks of, you know, 20 minutes every day doing some regular stress management techniques. And instead of getting that response, they get that response. And also in those initial experiments, you know, the stressor goes on, you know, the physiologic response goes up, the heart rate, blood pressure, whatever it is, and it lasts for a certain amount of time. And then after they did the training, it comes up, but it goes down faster. So the actual training the mind-body system teaches the physiology to come back to the neutral more quickly. Because what you're actually doing is training the relaxation response. It's like lifting weights, you know, like the first time a person goes in and tries to train and lift weights, and you know, they lift like whatever it is, 40 pounds, and they can do it 7 times, and they're like, you know, and after doing that for a while, they can do it 15 times, and they can increase the weight. And all of our physiology has plasticity. Plasticity means changes with experience. And, you know, one of the cute little buzzwords is, excuse me, one of the cute buzzwords is nerves that fire together, wire together. And when people do training, whatever it is, whether you're learning to memorize things, or you're studying and analyzing texts, or you're lifting weights, or you're training your physiology, practice shifts things in many cases. And there's various tools and techniques that we do to do that.
This is really, I have to tell you, this is not just for any interview. I'm blown away by this.
Mel, you're gonna have to book your own session if you want to.
I'm not asking anybody, because I'm going right into my own session
I'm
here,
joking.
like one-on-one.
You're like, so let's just say hypothetically
Let's just pretend
that my wife,
with
somebody's
beard.
wife said something and it triggered something in me. What would you do about that?
Right. Hold on a second. Let me write this down.
All right, don't worry, it's recording. All right, we'll let you go through the presentation because it's a lot to cover.
Let's go further. All right. All right. Right. Yeah. Okay, so let's go. Let's just talk about, like, just so you know this is a real thing. This is like a side picture of someone's brain and spinal cord, like cut down the middle. And do I have a cursor here? Oh, I do have a cursor, right? You got these little areas in the core of your brain that what we call the hypothalamic pituitary adrenal axis. And most people have heard of the adrenal glands that sits on top of your kidneys, and that produces epinephrine and norepinephrine. And those are acute stress hormones. That's adrenaline and noradrenaline. Most people have heard of those. And, you know, some people have had allergy attacks, right? Where they have to get a shot of epinephrine because it, you know, saves their life pretty much. And anyone who's ever had that would tell you, oh, it feels like anxiety, and oh, they just feel horrible, like they're scared, because epinephrine is that activation stress hormone. You know, the big boom goes off and my building's on fire. Oh, I get up and I like carry a 200-pound person out the door and down the stairs. That's what stress hormones do. They get up and go, fight, flight, freeze. You know, and so that's in the adrenal glands, and that's one of the stress hormones. And there's hormones that come out of the pituitary and stimulate the adrenal glands. And then you've also got the pituitary itself, which stimulates cortisol production. And cortisol is another stress hormone, but it's kind of like the slow stress hormone. Everyone's heard of cortisone injections for various problems. Somebody has too much inflammation, they might get a cortisone shot. whether it's in a joint or something systemic. They might take prednisone, something like that, for really bad inflammation. And so these are hormones that are involved in the stress response throughout the body, and they're also involved in inflammation and a bunch of other different things. And there's also peptides. Peptides are what colors the overall experience. So for instance, we talked about how playing sports or dancing at a wedding is a stressor, but wait, it's fun and I feel good from doing it. And being in a catastrophe or a fire, God forbid, or being really sick is a stressor and I feel horrible after. What's the difference? It has to do with the magnitude of the stress response, but it has to do with the other biochemistry and neurologic activity that's giving a color and a valence to it and helping me frame it and understand it. Does that make sense? I hope so. Okay,
Yeah.
let's go further, not to get too caught. I don't want to be freaking people out with all this anatomy. Just to sort of share a few other things, like there's
These pictures
other
are really stressing
compounds.
me out. All this brain stuff.
Right.
Like, I don't know if I can handle this.
There's various other neurotransmitters that are involved. Neurotransmitters are chemicals that the brain uses to communicate between the brain and the nerves. And past 20 or 30 years, we realized that neurotransmitters also help the brain and the spine and the human being communicate with the immune system and the intestines and everything. But we still call them neurotransmitters because that's where they were discovered. But there's things like GABA, which is where those benzodiazepines, medications like Valium and Clonix or Klonopin work. We talked about this young man who was on this medication. Ativan is another one. Those work on this GABA system that kind of creates a relaxation and imposes relaxation on an overactive stress response. And so those sedative medications basically quiet down an overactive stress response. Okay, let's go forward. So this is a picture or a schematic diagram of the autonomic nervous system. And this is where the stress and relaxation response is in the nerves themselves, right? This is showing us the biochemical aspects of it in the hypothalamic pituitary adrenal axis. And here we're looking at a cartoon showing this autonomic nervous system, which is actual nerve activity, right? And so we're looking at the same section of the brain, and here's that hypothalamic pituitary thing going on. But then we got these nerves going down, and at every level of the spine, we've got the sympathetic division, and like we talked about, that's your stress response, fight, flight, freeze, get up and go response. And on the other side, we got this parasympathetic branch, which is the relaxation response, recovery and repair, rest and digest. And at different levels of the spinal cord, you got all these parasympathetic branches coming out. See this little X here? That's what we call the vagus nerve. That's really important. Vagus means wandering, but it's this big long nerve that comes out of the brainstem and it goes to all of your internal organs. And it's the nerve that brings your parasympathetic relaxation response. So most people have had the experience of like, okay, something's happening where they're relaxing and they're finally sitting down at the end of the day and their belly starts to gurgle. Like that's because your parasympathetic starts to be stimulated and your vagus nerve is stimulating your gut. We talked a bit about stress and inflammation before. There is what we're calling now the vagal inhibitory pathway for inflammation. And what we're finding is that stimulating the vagus nerve actually blocks the production of inflammatory hormones so much that they're approving and now doing, for some people, implantable stimulators, the vagus nerve. And like some people who had horrible rheumatoid arthritis with all sorts of inflammation, it just stops it by stimulating the vagus nerve. It's crazy, right? You're stimulating very strongly the parasympathetic relaxation response, and it's stopping an autoimmune disease.
Oh.
It's powerful. And so, what's also shown up in the past 10 to 20 years of research is what we call the gut-brain axis or gut-brain connection. And that's whatever, we could spend hours talking about that. But briefly speaking, what's going on in our brain affects what's going on in our gut. What's going on in your gut affects what's going on in your brain. Your gut is a massive immune organ. Chronic or acute stress can shift the balancing functions of the gut and the healthy protective barrier of the gut in a way that generates inflammation. And the inflammation from your gut and the changes in the biome, the bacteria that live in your gut, have an influence on the way your brain functions. So we're finding that people with anxiety and depression and schizophrenia have changes in their gut biome and the function of their gut barrier function. We're finding that's true in a variety of different chronic illnesses across the board. Pretty much every specialty journal is starting to talk about gut-brain axis and how what's going on in your mental, emotional, stress, relaxation has an impact on your intestinal function, which feeds back into your entire body and influences your immune system and affects inflammation and affects neurologic functioning and mental, emotional functioning and hormonal functioning and so on and so on.
Wow. But that's all starting, when you say a mind-intestine relationship, I would guess it's starting somewhere from the mind that's sending a message, right? I mean, it's a perception.
Wow.
It's not starting from the stomach, because the stomach doesn't know anything, am I right?
Well, what if somebody eats something really horrible, right? I mean, this is a more subtle thing that's a bit kind of like, research is still catching up with the clinical phenomenon, but there are people that come to me all the time who have gotten some sort of gastrointestinal infection that triggered an horrible fatigue and widespread body pain that came on after that. And so I think, you know, the question you're asking, it's a good one, it makes sense, and everybody asks that, because no matter how much we talk about integration of mind and body, people are like, so you mean it's all in my head? It's like, no, it's not. It's in your mind body. It's one unit. And to say where the stimulus starts is often misleading. For sure, the stimulus can start in one place or another, but then it's a loop and the two are influencing each other. So in other words, this gentleman who came to me, he had an inflammatory illness in his body, right? He had a fever. We all know that the people who get really sick with this this virus, it's an inflammatory problem in the lungs. The immune system goes on overdrive, and that's what causes people to get really sick with that virus. He didn't get that sick, but he was inflamed. He was febrile. He felt horrible. He couldn't get off the couch. That's inflammation. And he subsequently developed a lot of anxiety. And so which came first? Was it that he was feeling anxious, that he was lying on the couch, he was going to die? Or that he had this whole inflammatory thing that affected his immune system and that was feeding into his brain and how his brain was processing? I don't think we'll ever know. But we've got pretty good evidence that both of those pathways are going on and that there's a loop there. And similar things I've seen with people who had digestive infections or issues, parasites, stuff like that. And so it's a whole unit, it's a whole system. You know, not belabor that. Okay, should we go forward?
Yeah, please.
Yeah, so most people probably know this from their experience, but when we have an acute stress response, the fight or flight response, what it does is prepare you for action. It prepares you to get up and go. And depending on the organ, it does different things. In the brain, it creates increased arousal and vigilance, like you're paying attention. Your eyes bugged out a little bit. You're focused. It increases the sensory system. It mobilizes energy. Your body shifts the hormones to mobilize blood sugar from your liver. Your stress hormones activate all aspects of your body. Increase blood pressure and heart rate. Increase breathing rate in your lungs so you have more oxygen to get to your blood, to go out to your body so you can fight or flight, you know. I don't think I mentioned this here, but there's a diversion of blood supply away from your intestinal functions and your digestive functions and waste removal to your muscles of action and your heart and your lungs. Your body has this incredible intelligence, I should say your body-mind, so that when there's a stressor, it closes down and narrows certain arteries and opens others so that the part of you that needs to do the fight, flight, freeze thing can do it. Your digestive tract has decreased secretions and decreased function and motility. That's why stress can contribute to constipation. Your neuromuscular system has increased reflexes and muscle tone and strength and blood flow. Okay, so look, it's normal to have stress. Like we talked about, stress can be a positive effect. It can be a positive thing in a person's life. And we're meant to have a normal balance of stress and relaxation. And I've tried to demonstrate in this little curve: stressor, I relax; bigger stressor, I relax some more. You know, it goes up and down. And over time, my baseline kind of stays the same, right? And I'm okay that way. But for various reasons, there's an imbalance. And the stress response overrides the relaxation response, or the stress response is persistent and consistent or really intense. And that curve changes, and that curve kind of climbs up over time, and you get this persistent stress response. And that can show up different ways in different people. For some people, it shows up as anxiety. For some people, it shows up as irritability, and it's just not nice to be around that person. And, you know, he or she is sharp and unpleasant with family members or coworkers. For some people, they have coping strategies for how to deal with it, and they might not be so productive. It could be alcohol or substance abuse. It could be aggressive behavior. It could be other addictive behaviors that get triggered when a person has more stress. And I should also just add that there is this phenomenon that they call habituation, where a person kind of gets used to the stress. I do these kind of weekly stress management sessions online since the beginning of this pandemic, just to kind of give people some tools for coping. And there's this really nice older lady who comes, and I think after the first time, she had some feedback. She said, you know, I came in here, I thought I was dealing with things, and I thought I was pretty cool. But then I did this breathing and focusing, and I got so relaxed, and I realized how stressed I was. And so we don't always know it because we habituate. We get used to it. You know, it's kind of like if you ever go into a library or a big building or something where there's a heating, ventilating system, and you might hear it when you go in, or you might not. And you're sitting there and you're reading or something, and all of a sudden it turns off, and you're like, wow, it just got so quiet. You didn't even notice it was there. But it was there in the background, but you just tune it out. And people tune out stress. And that's part of where it can be harmful over time, because a person is not really cognizant of it. And because they're not cognizant, they're not taking positive measures to cope with it, to work with it, to shift it. And again, whether that's reframing it mentally, emotionally, figuring out different strategies for how to think about their circumstances, working more creatively, working around the challenges, or working with it on a physiologic way, which we haven't really talked about yet, but there are tools for actually bringing on the relaxation response. There's tools for intentionally generating certain states of mind that help a person tolerate and cope with stressful circumstances more effectively. So, you know, this little drawing talks to the issue we talked about before, right? And this comes from the work, again, this is decades ago. It's developed a lot since there, but there's this wonderful researcher with a completely unpronounceable last name, which I think is Csikszentmihalyi. Yes, he's a Czech researcher, and he came up with this concept of flow state. And everyone's heard of flow state at this point, for the most part. And he came up with the concept of studying performance. And what he found was that, you know, there's challenges, and there's a person's skill or ability to deal with the challenges. And the flow state is where those are in balance, right? If a person's challenges override their skill or perceived ability to deal with it, they get anxious and they're not performing so well. And if a person's skills are really high and their challenges just aren't so great, they can get bored, and then they're not performing so well. And, you know, he was doing all this research in the context, I think, of business development and organizational behavior. But so like he said, you know, you got to find the flow state where your challenges are balanced with your skill, and that's your flow channel where your energy flows, where your motivation, where your performance with your, you know, going for it, and you're feeling good.
I'll say also for a manager to know, you know, what type of work is, you know, too challenging according to their skill set. You don't want to give somebody the wrong type of work,
Right,
or
exactly.
under, give them something that's below
Right,
their pay grade, because
right.
they'll just be bored.
Yeah, exactly. Yeah, and I think this is also, I think you're already acknowledging this, but it's such an incredible tool for self-awareness that anybody who's got challenging circumstances in life, anyone who's trying to perform and do positive, meaningful things, needs to be thinking about this concept of how are my challenges in relation to my skill? And again, it's very much their perception about those two things. But
Mm.
like, am I reaching too high and overwhelming myself? Or am I like reaching too low and I'm gonna be bored and disinterested and not really gonna get much out of it? Because I think most of us, just from common sense and life experience, we know that when we are challenged to do meaningful, purposeful things that require us to go beyond ourselves, we actually enjoy it to a certain extent. There's something meaningful about that for
Yeah.
human beings. And this is maybe an aside, but maybe it's very relevant to our current circumstances. But the incredible insight that Viktor Frankl brought to the world that most people are familiar with. And he was a psychiatrist who lived through Auschwitz, through the horrors of that death camp. And his observation was that who were the survivors? The survivors were the people who found meaningful, purposeful challenges or things that they did, whether it was helping out other inmates or, doing their spiritual practice. People who had some sort of focus to bring them into meaningful activity. Okay, and so I think that's, yeah, just briefly running through this. I think we're kind of running out of time.
Yeah.
Can't see the chat message that's being sent to me right now because I'm on screen share mode. Just sort of briefly looking at effects of chronic stress, because this is where it becomes the illness thing, and this is the things that people come to me with, right? And I'm not sure if we sort of talked this in detail in the beginning, but like, all right, a person's got this illness. Is it just stress, or are they really sick? And the answer is that it's often a mixture or a dance of those two. And clearly there are certain things that happen to a person where like they fell off the house and they broke their leg, or, who knows what it is, but they had an event and it's just the event. And you could say, well, what were you thinking about? And that's why you fell off the roof of the house. That's another story. It could be a mind-body problem. And those are the things that are really very much just related to stress, anxiety, depression, where people get sick from that. And then there's this whole gray area, which in my eyes is most illnesses, where there is this illness process, but there's a way that stress physiology can, first of all, worsen the expression and the subjective experience of being with that illness, whether it's pain or inability to do stuff that a person cares about, or isolation, or whatever it is. And then there's a way that stress and the stress physiology we're talking about feeds into that disease process and amplifies it. So let's just kind of run through this a little bit. But some of the things that happen in the brain because of chronic stress: insomnia, irritability, anxiety, depression, impaired learning, brain fog, dysregulation of your hormones, hypertension, arrhythmia, coagulation issues. Chronic and acute stressors have been shown to be associated with triggering cardiovascular events. Like, this is no joke. And a lot of it has to do with the way your platelets work and coagulation and, what is a heart attack? We talked a bit about the effect on the immune system, either driving inflammation or impairing the immune system and causing suppression of the immune system. There's all this research looking at stress and immune function and showing that people who have chronic stress don't respond to vaccines or viral infections with antibodies, like someone who doesn't have chronic stress, which is really important during these days. We've got this undetermined thing going on. We don't know what's happening, what the next wave is with this virus. And it's just really important that people learn to, like, okay, let me figure out where I am on my stress scale, and let me learn how to cope with it in some degree of way, some way, and not be living in that fear, anxious place. Digestive system, I don't want to go too much into this, but irritable bowel syndrome, inflammatory bowel syndrome, constipation, well-known things with a stress-related component, neuromuscular problems like cramping and pain and tight muscles, and increased pain transmission. I might have a slide here looking at that, I might not. But there's a long research for decades looking at people who have various physical symptoms, really just from stress. And when they do mind-body stuff to like cope with it, psychotherapy, whatever it is, they reduce their somatic symptoms, physical symptoms. Yeah. So just briefly, do you want to do a transition? No. Okay.
I put it on mute because I didn't want people, like, their kids running in the hallway outside my office here, so I didn't want to make noise. I think that how can we sort of, this is amazing, but I have to get somewhere, but I'm saying if we could, is there a way to wrap it up so we don't leave in the middle and we can
Yeah.
do it in the next session to continue on?
Sure. Yeah, I'll wrap up in 2 minutes.
Okay.
Yeah. So,
Perfect.
okay. So see, these are some of the chronic effects of chronic stress. Just briefly about pain and stress. It's something I do a lot of because I do a lot of pain management. But the point is that your pain transmission system is not like the electrical wire in your office where you flip the switch and the light goes on. You've got this really complicated system that transmits electrical chemical energy to the spinal cord, from the spinal cord up to these sort of signal processing centers in the brain, and from there up to the part of your brain that says, ow, my foot hurts. And there's different aspects to that pathway, and those pathways can be amplified by chronic stress. They can be amplified by negative emotion. And, briefly, like, your emotional experience can affect your perceived pain, and your perceived pain feeds into your emotional experience. So we could talk about these sorts of loops between sensation and physical disease processes and stress and emotional upset and anxiety and emotional distress about almost every aspect of the body and almost every kind of disease process. But let's just leave it at that for today. The good news, I think, that everyone should know after talking about all this sort of, wow, stress is bad stuff, is that there is what to do about it. There's something called neuroplasticity. And neuroplasticity means the nervous system and its relation to the entire body and mind is plastic and changeable with experience. And whether it's reframing and figuring out how to think about things, and this is what cognitive behavioral therapy is about. Let me think differently about it. This is what a lot of spiritual training and practices and learning and training are about. Let me think about this in a positive light. Let me have faith. Let me figure out how to shift my mental processes so that I see this in a positive light. I don't perceive it as threatening. I perceive it as an opportunity for growth and transformation. And then the other aspect is that there are ways of training the whole body-mind system to respond differently. And so we could speak about that at another session if people want to hear about it. And great to be here. So thanks a lot for having me.
I think it's amazing. There's a lot more to go over. That would be it would be an honor to have you back on and go through that. It would just be great. I even now, as you've spoken today, I've even in one session, I can see and really understand much better how the mixture between diet and exercise and a mind-body type therapy or whatever that is will it's almost like readjust the whole body and interconnection between the mind and the body so that everything works with synergy, and it could bring, I see how it could bring a health to the whole body.
Right. Yeah, I mean, I think it kind of sums up in the saying that many people know, which is that that the source of life made human beings with a divine intelligence and the way that shows up, what science shows us is that we've got all these incredible systems of self-regulation and self-repair, that the body-mind system knows how to fix itself most of the time if we give it the right raw materials in terms of how we are living and our lifestyle. And there's a lot of opportunities to feel better and to live at a higher level based on the choices we make on a regular basis.
Wow. I could see how it could stay also if a person, the way you described it, doesn't readjust things. They could be going to every a stomach doctor, a leg doctor, separately a psychologist, and they just can't figure out what's going on because they're stuck in a place where everything's interconnected, but they're trying to deal with one piece, and the source could be down there, up there, on the right, on the left. It's interconnected.
Yeah.
So it's okay. This is great. So God willing, we'll have another session, and we'll go through some of the techniques, perhaps, of how to adjust or fix the stress or issue that people are living with.
Okay.
It was great. Thank you.
You're welcome.
Thank you, Dr. Shiller. Appreciate your
All
time.
right. Pleasure to be with you.
Be well. Have a great day.
Have a good Yom Tov if we don't speak to you.
Oh, yes. Great.
Right. Good. Thank you.
Thank you, everybody, for joining us. And until next time, get broadcasting.
Thank you.